Hey guys, so this video is specifically for my health. It's a vlog video. So, I just put up a video just now, just my everydayness, but this one is just for my health. So, in case you're following along, it's been a while since I posted a vlog video about my health and stuff. So, this one is going to be a little bit of everything, I guess. It's not too much to report on. It's just more about what's going on with me health wise. I have been already working on setting up a schedule, so supposedly, on what I'm going to do as far as workouts and things like that. So also came across, and I think it was through Facebook. I think you know how you get sometimes the algorithm gives you these little advertisements. Well, there was one that was called Rhythm.com, and mind you, I'm not getting monetization. I'm not getting any of that stuff. It's not a sponsor. I'm just letting you know I came across it. It is free. It's basically AI. And how I feel about AI. I'm okay on it. I'm fine with being with AI as long as it benefits us. You know what I mean? It's not going to hinder us or hurt us. So I think it's if it prolongs your life and it makes your life better and happier or whatever, then so be it. You know what I mean? I welcome it. So um, Rhythm is it's basically an AI tool. It literally doesn't need a whole lot of information. It will need like a photo of your ID, your front and back of your ID, which that took me a little bit a minute to get because it kept telling me it couldn't read it. I don't know, it's weird. But I kept trying, but I finally got through it. And then it verifies your face, whatever it is, so facial recognition, looking forward, left, and right, and then you're good. And you enter whatever little small information you need about yourself, like your birth date and stuff like that, and your email address, your phone number, whatever. And it actually pulled some of my doctor's notes from all the doctors that I went to, and even a couple ER visits that I went to from years ago or whatever it is. It actually pulled some of the doctor's notes. Now, doctor's notes, you don't really get privy to that when you're at the doctor's office. It's your notes the doctor puts in, or the PA or the MA will put them in as the doctor's talking or whatever, or afterwards, after you get ready to leave, they write these notes, and you don't really see them. You don't know what's being said about you. And it's funny because I was shocked. I came across it, and one specifically was when I went to the ER when I got COVID the first time, and I kept passing out, and I was like, literally, I needed help, and I couldn't breathe and everything. So I ended up going to the ER, and they literally, this was in 2021. So the ERs were literally still being really strict about who can come with the patient, and the patient has to be by themselves. Your family can't be with you, all this stuff. So I was like, okay. I had basically, my mother in law took me. She stayed in the waiting room, and then I went back by myself. Well, I ended up going through this whole thing. I also had them also check my foot out because during that time when I passed out, I literally like hurt my foot, and it started to swell up and bruise up. And I think because I fell off this edge of my bed, I was trying to stand up and I ended up falling forward, and I toppled downward, and because I passed out. And I kept coming back and forth, passing out, waking up, passing out, waking up. And so when we called the ambulance was like, the paramedic was like, they're not gonna do nothing for you. Okay. And so he didn't do anything. He's like, I can take you, but they're just gonna send you back home. So he was really rude about it too. And I was like, dude, whatever. So my mother in law took me to the ER, and then when I went there, they ended up giving me a breathing treatment because I have asthma, and I did a nebulizer for a good like hour almost, and then they did a chest X-ray, found out I had pneumonia on both sides of my lungs, as well as they also checked my foot, and they found out that my foot looked it was it was really really bruised up, but it looked like it was like a hairline fracture in one of the bones or whatever it is. So but the way it's done, there's really nothing you can do about it. You just got to let it heal. So they actually tried to fit me with a boot, and then and that was it. So I kind of find out when I read my notes, I looked on there, And it said that actually on my chest x-ray, I had a nodule in my lower left lung, and that I would, that I, it said that I was advised to check with my follow up in 6 to 12 months with my care provider or with a lung specialist. They never said that. They never told me anything. In fact, what happened is they released me with a prescription for some steroid medication, some cough medicine, and a referral to get an antibody treatment. That was it. They mentioned nothing about that. So I could have still have some kind of like a mass or some sort in my lung and not know about it. Even though I've had chest x-rays since then, but that doesn't mean they weren't looking in the right direction, or they probably are, because I haven't mentioned anything, they probably just don't think of it, or they could be missed. Who knows? And then and then there was another note from another doctors that are talking about how they mentioned about my weight is the reason why I'm having all the problems I'm having. My weight is the contributing factor of why I feel dizzy, lightheaded, I feel like I'm passed out, or I feel like I am like, or I have migraines and I have all these issues. It's because I'm fat. Really? I was fat before I had all these problems. I don't think that was the problem. I don't think that's the case here. And I was shocked. I was like, they wrote that in my notes. Didn't tell me that. My primary care doctor, most of his notes are literally, it always mentions about me being morbidly obese, and it mentions my BMI, and mentions that I need to lose like 20 pounds, 30 pounds, things like that. It constantly talks about that. But does he mention it every time I go in? No. But it's mentioned as if he's discussed this with me. He's mentioned it one time, and that was only because I went to him to get a regular wellness physical checkup to make sure everything is good and working order. And before I started realizing, if I need to, want to jump on the bandwagon of trying to work out again and trying to eat healthy and get myself together, again, while I can on days that I feel decent and feel good. That's what I was trying to do. But apparently the doctor, he only mentioned it that one time, which made me kind of mad a little bit, because the way he did it was he was really condescending. He's making comments and was smirking a little, not really smirking, but it was like a really a-hole kind of way. And this doctor is normally not like that, which is crazy. He's normally not like that towards me. And I don't know if he just didn't have his Wheaties that morning or what, because he is like, and this is the first time my husband actually went back with me, because typically he would just sit in the car or he'll sit in the waiting room and just let me handle my business, because I'm a big girl and I can handle my business. And every once in a while I want my daughter to be with me because we're besties, why not, and plus it gets boring when you're waiting on the doctor and you're just sitting in the room, so you have someone to talk to. Well, this time my husband was like, I think I'm going to go back with you, since my daughter was off to college. He just wanted me to do something nice, right? So he was sitting back with me. The first time ever he has met my actual doctor. He is normally because he's never really met him. I have, because my doctor usually stays in the back of the building most of the time by the room, so he never comes forward. So where my husband usually sits out in the waiting room and stuff, so he's never really met him. So I ended up thinking, okay, cool, then maybe you can meet him, And so he comes in there, and I told my doctor, I said, yeah, I'm here just for a wellness checkup, basically like a physical. I just need to make sure everything's good and going, because, I'm thinking about, trying to eat a little bit better, and I'm going to try to work out more and stuff like that. But I want to make sure that I get the okay, because they always say, make sure you consult a physician before you start any exercise or workout or diet, correct? So I was doing the right thing as a person that I've been told to do. So I was back there, and like he kind of did the work over, literally. He measured, like he was doing all these measurements, and then he was asking me, do you have joint pain? Do you have this, that? Well, yeah, I have fibromyalgia. Yes, I have joint pain. Oh, you have headaches? Yes, I have migraines. Yes, I have a chronic migraine. This is why I do Botox, and which has been okay lately. And I have been, and I'm like, well, do you have, do you have any problems breathing, or how's your heart? And, does it race, whatever? Yes, I have that because I have anxiety. Yes, it's going to race every now and then. My breathing, yes, is going to be labored sometimes because of it. And yes, sometimes I also have asthma. So yes, I do have those issues. But he literally was sitting there every time I tell him yes, it's because I have this. He's like, well, it's like, well, you are overweight. It's going to contribute to these. These problems can be because of the weight. And I'm like, dude, you have been treating me for a couple of years now, or several years actually. And the only reason I started going to you because my other physician was actually in the process of being retired. And the only reason I went to that one is because my primary one my first one I've always had most of my life, he literally passed away. So he died. So all his stuff went up to this other physician, and that physician, he was good up until a point where it seemed like he started to branch out and started to look for other people to take over his patients. And I didn't like the people he chose, and we didn't get along very well. And it was more the attitude and stuff like that. So I feel like they weren't listening to me. And if I wanted to just see him, it was take months before I can get an appointment. So that's why so I had to find a new one. Found this one, and he's like being condescending toward me, act like my weight has, you've never mentioned anything about my weight until I had this physical. You don't talk about it. You don't mention it. I come in with a problem. You don't say, well, you maybe need to lose some weight. Have you seen anything? I had to bring it up. I brought up a nutritionist. I brought up the dietitian thing. I'm I'm the one who brings it up. So if it is truly my weight that's causing my problems, when you say something, way before, until you just wait till time goes on and I'm getting slowly bigger or whatever it is. And have you managed during that time when I had my physical? I was actually on my period at the time. So yes, I was bloated. I was a moment emotional and everything. And I let him know that. And he still was like, he being big man over here, sitting there talking about how like, oh, I just need to lose some weight. And that will solve all my problems. He reminds me of this one OBGYN that I went to when I was trying to get pregnant with our daughter. And he literally would sit there and say, well, go and have a gastric bypass. You'll lose weight. If you lose weight, you'll get pregnant. That didn't happen. I still got pregnant without having to lose weight, and I still got pregnant without having to worry about that. Yes, I had to take some fertility medication, just literally just a pill, every month. But it took a couple tries, but in timing, and I was shocked that I actually got pregnant. Because I didn't even feel pregnant when I got pregnant. It was weird. The doctor was like, he had to prove to me I was pregnant because I really didn't feel pregnant. But it was like, but I thought, okay. I decided to have a gastric bypass back whenever my daughter hit about almost 1 to 2 years old. I was like, okay, I think it would be a good time for me to, if I want to look into this. So I looked into it. When it had it, because we wanted to have a second child. So I thought, well, maybe I'll entertain that idea. Let me go have this gastric bypass. Let me lose the weight. I lost a ton of weight. I mean, I've lost a lot of weight, and it was like I got almost down to actually my chart ideal weight, and I still could not get pregnant. And I literally was in tears because I was like, all this time they kept telling me, lose weight, you'll get pregnant. That's not always the answer. There are skinny women out there. There are thin women, average size women, women that are actually perfect in their charts, height, weight, and BMI, all that's normal and within average ranges, can still have fertility issues. So I don't understand why they think that weight is the answer to all the problems. You look at a person who's obese and you say that's the reason why you have issues. The reason you're dizzy and you're lightheaded is because you're overweight. Are you sure about that? It makes no sense. I mean, I had an old babysitter of mine. I mean, she was really big. I mean, if you look at the people in my 600-pound life, she was that big. And she was very young. She was in her 20s. And we found out years later that actually all her weight was not because she was just that. It was actually she had masses of tumors that were growing inside of her. And she didn't even realize it because she never could get to the doctors because she didn't have transportation to get there. And this was back in a long time ago. This was back in like 80s and 90s. So, but we found out, and she ended up, when she did find out that she had tumors and stuff, she actually passed away in her sleep eventually, and it was too late. I mean, they were too big and too massive to work on. They couldn't remove them. I mean, it was like she had an expiration date, and it was pretty sad. But I mean, but if you look at her, you would think, oh, she just eats too much. She really didn't eat a lot. Did she eat healthy? No, but she really didn't eat a lot. I remember. So it's like, it's crazy though that someone looks at somebody and says, oh, you have health issues because you're fat. And that's not true. So if you are overweight, please do not be discouraged and think that, oh, all your health problems are because you're overweight. Do not feel bad about that. And because there are thin people that have the same problems you're having and they're not overweight. So it could not be just your weight. Now, with that being said, though, yes, joint issues, yes, weight can play a role in it, but that was not the reason why I had joint issues. Does it exacerbate it a little bit? Yes. Do my migraines and stuff like that, they've proven, yes, weight can have that problem too. High blood pressure can have that problem. Any of those problems can have. I mean, there's a lot of things. Yes, dizziness, lightheaded, yeah, it can happen when you're overweight a little bit because you are not breathing very well, or you're not getting enough oxygen, or you're not moving enough, or you move too much and your body's not used to it. But it's not the reason, the actually primary chief reason why you are having those problems is not just your weight. It is all, there's other issues. So if a doctor tells you it's your weight, you need to lose weight, and they don't listen to nothing else, find another doctor. There are doctors out there that will listen. I have gone through so many doctors, and I found a few that actually would listen. And if they don't listen to you, you have that right to find another doctor. You have to be an advocate for yourself. So with that being said, though, guys, so I'm actually in the process of getting ready to actually start working out. I'm thinking maybe next month. I think to me it's easier to do things by the first of the week or the first of the month because it's easier to track. But yeah, I'm thinking about doing that. I think this month, January, is just a cleaning, organizing, getting on a regular schedule. I need to get better at my sleeping, going to bed on a certain time and waking up at a certain times. I need to get better on doing that. Even though if I have nothing else planned to do that day, I still need to get on my circadian rhythm needs to get better. I am working on trying to get my asthma under control. I feel like my regular inhaler is not working very well. I contacted my doctor. He prescribed it's a new one out there. I saw the commercials the other day. It was Airspira. And it is, it's like albuterol with some steroids or something like that. And it's like a dual action one. But the problem with that, my insurance doesn't cover it. It's like $500 something every month. And I'm like, no, that's ridiculous. That's groceries right there. No, I'm sorry. I'd rather eat. So, and thought we were talking about weight here. But I mean, it's like, that's a whole like utility bills. That's like, for most people, that amount is like half their rent. I mean, it's ridiculous. So, and I'm like, I'm back to the drawing board on that one. So I actually am trying to get into a pulmonologist, see if I can get a lung function test and see if there's other options for me. My doctors did say though, since my insurance doesn't cover that medicine, they do have samples, so I could come in the office as they have samples and just pick up some and see if it helps. But right now, yes, I need to get in and get all this worked out. I'm really want to wait till like after I get through getting a D&C done. I'm doing a D&C done. If you don't know what a D&C is, it's literally a dilated and curettage or something like that. It's literally, I don't want to be graphic here, but it's basically you go under anesthesia and the surgeon literally goes in, dilates your cervix, goes in through your uterus and literally scrapes some of the cells from the lining of your cervix so they can check to see if there's any cancerous cells. It's usually done so they can make sure if people that are having problems getting pregnant, but I'm not trying to get pregnant. I'm past that point now. But it's more of the trying to figure out why I have unexplained bleeding every now and then it doesn't make sense and nothing is helping. So we're trying to figure out making sure there's nothing going on. It's a really quick procedure, but unfortunately, yes, I'll end up have to go and be put to sleep for them to do this and recover and everything like that. And so I was gonna wait till I finish that. Well, I end up going to do that next week. So when I get done with that and I recover from that, then I will work into looking and going to the pulmonologist, figure out my asthma stuff, and figure out what's going on there. And then I will end up starting to work out and start doing my eating under control. I think I've mentioned before, I did sign up with the Mayo Clinic diet. This one I haven't tried before, so I'm gonna try it. I think I put a video out explaining that one. So I'm gonna start working on that one. I'm gonna follow their grocery list, and I'm gonna try to get as much as I can on it, and if I can afford it, and then make my meals like they say, and let's see. My goal is honestly to lose 30 pounds by my birthday, which is in June. So if I don't, I'm thinking anything over 10 pounds is a win, because to me, anything under 10 pounds, it could be water fluctuations. I'm not saying it doesn't count, but it feels like it's too easy and too close to kind of gaining it back. Anything over 10 to me feels like, okay, you're actually losing weight. So I'm also thinking about doing my measurements, because I've never done it before, of actually tracking my waist measurements, my hip measurements, things like that. And I'm just going to incorporate basically light walking, some light weights, and just eating, and just basically just kind of doing that. I've got to baby step myself into it. So that's the goal, mainly in February, and just kind of tracking that. And then by March, I want to step it up a little bit and add some cardio to it. Do more brisk walking, more longer walking. Do more heavier weights. Maybe incorporate some abdominal exercises, and kind of get into a little bit better. And then in very March, April, I'm hoping to get to a point where I can actually not just do that, but I also want to I'm gonna slowly start stepping up more cardio, where I'm actually literally sweating, working more heart healthy, workouts and things like that. So, of course, I'm going to listen to my body. If I take time down, then I will, but I'm going to make it count. So on days that I'm aching, or I don't feel like working out, I'm going to at least use those days that I'll do some light yoga or some stretching, and really kind of be a little bit more mental health, days. But yeah, I'm not going to beat myself over it. If I gain, but I'm hoping to lose. So yeah, anyways, I hope you guys stick with me, follow with me with this, and I'll keep tracking it and see. I mean, if you're starting to, maybe we can do it together. Who knows? Comment down below, let me know how your progress is going. Give me some ideas and tips. I'm curious. If you're on the Mayo Clinic diet, comment down below. Let me know how it's working for you. I am part of the Facebook group. It's a private group, so I'm still kind of learning how to work the app and everything like that, because it is a little different. But yeah, I'm hoping for a bunch of losses over here. So I guess that's it. Wish me well on my surgery next week. I don't know if I'll post again until afterwards. And mental health wise, I'm doing okay. I'm doing better. As far as my anxieties go, it hasn't been that bad since I got over being sick. It hasn't been that bad at all. I've been basically just taking some diazepam once or twice a day, and I'm seem to be okay. So, and my allergies, they're getting better. I had to start over on my shots because I missed a couple weeks because I was sick, so I had to start over. But I'm hoping to continue on, and hopefully it'll get better too as well. So I think I'm in a good trajectory. I'm in a good path. It just seems to be a couple little stepping stones, and or I guess speed bumps in between there. So, that's how life works. It's not always going to be a smooth path, but yeah, I guess that's it. So, thanks for your support. Thanks for not judging, being kind. Please keep your comments kind. Please be supportive, because I really need it, and I really enjoy it. And make sure you stick with me, and I will see you guys next time. So, stay tuned, and I guess that's it. Happy losing. All right. Have a great day. Bye.